In the heart of Mafutseni, a community waits, resilient, hopeful, and eager for change. For years, accessing basic healthcare has meant walking long distances, enduring discomfort, and sometimes making impossible choices.
One of our biggest challenges is the growing number of people living with diabetes. Many are only discovered during home visits because local clinics are far and not visited often. Without regular checkups, diagnosis is delayed, and by the time help arrives, some patients face severe complications, even amputations. A nearby health facility would mean earlier detection, quicker treatment, and fewer lives altered by preventable outcomes. RFM hospital is too far, especially when emergencies happen at night. Pregnant women often go into labor at odd hours, and because of the long distance, some end up giving birth on the roadside before reaching help. A closer facility would prevent these heartbreaking situations and ensure safer deliveries for mothers and babies. Many people walk long distances just to reach a clinic. One person shared that it took them nearly 2 hours on foot. A nearby health center offering a range of services, like screenings, diabetes and blood pressure checks, and more, would make a huge difference. We truly need a place where care is close and comprehensive.
Our children commit suicide. It is tragic. We really need the help that the clinic will be offering.
Community healthcare workers have become the backbone of this area, tirelessly bridging the gap between the people and the care they need. But the burden is great, and the need is growing.
They know the people better than us. They know what the needs are. They also probably know some of the solutions that we can implement. So working closely with them will actually have a huge impact. At the end of the day, we want to see a healthy Swaziland, a healthy nation.
To answer this call, a new health facility is taking shape. Located at the center of Mafutseni, the clinic stands as a symbol of what's possible when determination meets action.
Mafutseni Primary Healthcare Clinic was conceived by the community of Mafutseni and UNESCO University after they received the donation of infrastructure from the Ministry of Transport and Works.
Our approach is a community development approach. Develop the community for better health. If we develop the community, we believe then health comes in as a surplus. Number of NCDs such as cancer, such as mental health issues, such as non-NCD diseases such as adherence to art and HIV medicine. We want to make sure that we provide those services here because they are a priority as far as the needs of the community are concerned. But we also want to preventive education for such diseases as diabetes and hypertension and others through lifestyle education to the people.
To introduce the services and ignite community awareness, an outreach event was held, drawing leaders, health experts, and families together under one goal: health for all. Guided by the powerful call to action, Mafutseni, Own Your Health, and under the theme, Prevention is Better Than Cure, the event encouraged individuals to take charge of their well-being through information, early detection, and access to care. The timing could not have been more fitting. The outreach came just days after Eswatini launched the 2025 National Health Day theme, Healthy Beginnings, Hopeful Future. A message that resonated deeply with the Mafutseni community, especially as they take their first steps towards sustainable, community-driven healthcare. From health education to screenings to maternal and child health services to cervical cancer screening, dental care, and HIV testing, the event was a powerful demonstration of what this new facility represents. Not just access, but ownership, empowerment, and a real step toward universal health coverage.
The majority of the population can and will be healthy if we have such a model like this one.
Georgetown was invited to provide technical assistance on how this facility would be developed into a primary healthcare clinic. And in collaboration with Georgetown University MedStar Hospital, we did an inspection and we found that the infrastructure and the community needs were aligned to the efforts of integrating HIV care services into primary health care, and they would serve the role of a demonstration site for primary healthcare integration. What we envisage as Georgetown from Mafutseni Primary Healthcare Clinic is this being a prototype for designing primary healthcare services where the community is engaged in addition to academia and the relevant ministries of health. We also look at this as being a potential research site, a clinical research site for the university and a collaborating center.
The people of Mafutseni have shown their readiness, not just to receive healthcare, but to take an active role in building a healthier future for themselves. This facility is more than just walls and equipment. It's a promise that no one should have to walk miles for basic care, that no mother should give birth without support, that no illness should go undiagnosed because help was too far away. But to keep that promise alive, we need support, resources, partners who believe, as we do, that health is a human right, not a privilege. Join us. Help sustain this vital work. Whether it's funding, supplies, staffing, or advocacy, your support can help transform this clinic into a beacon of hope and healing for Mafutseni and beyond. Together, we can turn this dream into lasting impact. Because when a community owns its health, a nation moves closer to true equity, dignity, and universal health coverage.
Thina sibaqhubheli sasemafutheni siyawuthanda umsebenzi wethu.